What you need to know about UroLift for the treatment of benign prostatic hyperplasia or BPH. BPH or benign prostatic hyperplasia is a term that describes the non-cancerous growth of the prostate and can result in the blockage of the urinary tract and result in changes in urinary symptoms such as frequent urination, urgent urination, a slow stream, or incomplete bladder emptying. There are a number of different minimally invasive therapies for BPH. There's Rezum, which delivers radio frequency through thermal therapy in the form of water vapor directly to the extra prostate tissue, causing it to shrink over time. UroLift uses tiny implants to hold the prostate lobes apart like curtains on a window to relieve compression on the urethra. Photoselective vaporization of the prostate or green light laser uses a laser fiber to vaporize tissue. TURP, or transurethral resection of the prostate, uses an instrument to scrape the tissue out to widen the channel. And TUMT, or transurethral microwave thermotherapy, uses a catheter to heat the prostate, causing it to shrink over time. There are a number of indications for minimally invasive prostate therapy: urinary symptoms that are not adequately controlled with medicine, an alternative to long-term medication use, patients who have urinary retention and the inability to urinate or empty the bladder are candidates, recurrent urinary tract infections related to an enlarged prostate, and recurrent blood in the urine related to an enlarged prostate are all reasons to consider therapy. The UroLift system is a treatment that is a revolutionary, minimally invasive approach to the treatment of an enlarged prostate or BPH. UroLift lifts or holds the enlarged prostate tissue out of the way so it no longer blocks the urethra. There is no cutting, heating, or removal of prostate tissue. UroLift is a straightforward procedure that's performed by a urologist. The surgeon places tiny implants to hold the prostate lobes apart, like open curtains on a window, to relieve the compression on the urethra from the enlarged prostate. This allows urine to flow normally again. The procedure can be performed in the physician's office under local anesthesia, and typically patients return home the same day without a catheter. After the treatment, most patients go home the same day without a catheter. There's minimal downtime, and patients can experience symptom relief in as early as 2 weeks. Some patients experience urinary discomfort during this recovery time. The most common effects are light blood in the urine, some pain when urinating, and an increased urge to urinate or discomfort in the pelvis that typically gets better by 4 weeks. Your doctor will discuss with you how quickly you can return to your normal activities. Most of the side effects of UroLift last for a short period of time and are self-limiting. Potential serious risks of any cystoscopic or prostate procedure include infection, bleeding, scar tissue, potential sexual side effects with a reduction in ejaculatory volume, or a failure to improve urinary symptoms. If temporary urinary retention occurs and a patient is unable to effectively empty their bladder, a catheter may need to be placed. Because the procedure can be done under anesthesia, you may need to fast starting the night before the procedure. Certain medications, such as blood thinners, may need to be held for several days prior. If you require anesthesia, a preoperative exam, including blood work and an EKG, may be required and will need to be done by your primary care doctor. You will need a ride home from the procedure and a responsible adult available for the first night after the procedure. Your doctor will tell you if you require anesthesia or whether this can be done under just local anesthesia. The procedure is usually done in your urologist's office or an ambulatory surgery center. These centers are usually adjacent to your urologist's office or in close proximity and are specifically designed for outpatient surgery. Some patients may need their procedures performed in a hospital, usually due to underlying medical comorbidity. The patient is brought into the procedure room and placed in lithotomy position. A local numbing agent will be administered into the urethra, and if you're receiving anesthesia, that will be given by a board-certified anesthesiologist. Once the anesthetic has been placed, a telescope will be passed into the urethra and through the area of the prostate. Several UroLift implants will then be placed with a special delivery device to hold the tissue back to keep the urethra open. Patients who have had UroLift report a significant improvement in their symptoms without significant downsides, especially as compared to other modalities such as alpha blockers and laser and TURP. After the procedure, you should expect that a catheter may be placed for 1 to 2 days after the procedure if you're unable to urinate to prevent immediate postoperative swelling. You may notice blood in your urine for up to 6 weeks following the procedure, but if there is worsening bleeding, clots, or difficulty urinating, you need to contact your doctor. Irritating urinary symptoms such as a constant need to urinate, intermittent burning, or more frequent voiding can occur and last for several weeks to months, depending on the healing process and the size of the prostate. Patients will also receive prescriptions for medication to help with burning during urination or pain. If patients are taking a prescribed narcotic, they should also use a stool softener to prevent constipation. Please call your doctor if you experience a fever greater than 101.5, chills, severe pain, the inability to urinate, nausea or vomiting, or significant amounts of blood in the urine, significant amounts of clots in the urine, and lightheadedness or dizziness. Please call your doctor or 911. The pre-authorization process is essential. We will communicate with your insurance to determine your coverage and any co-payments or deductibles that you might owe. We will provide you with an estimate of any charges that you may incur, and all charges are due prior to the procedure. Payment plans can be arranged if necessary. A surgical scheduler will give you a date, and you may need medical clearance from your primary care physician or internist, including a history and physical exam. Additional testing can include blood work, an EKG, and a chest x-ray. You will receive a letter with all of this information about where and when to report. In terms of special preparation, if you are receiving anesthesia, you should not eat or drink after midnight. Our nurse will call and discuss with you the medicines you can take the morning before surgery. If you're taking a blood thinner like aspirin, Plavix, Coumadin, Xarelto, or Eliquis, please let your surgeon know as special precautions may need to be taken. Remember, never stop these medicines without a discussion with your primary care physician first. Please arrive early to your procedure, at least 1 hour prior to the scheduled time. If you are receiving anesthesia, make sure that you have a ride home. That person must come and stay the entire time of the procedure. We hope that your procedure goes as well as possible and that you have a speedy recovery. We appreciate your genuine feedback regarding your procedure, as we are always trying to improve the care that we provide our patients. Should you have any questions regarding your procedure or recovery, please contact your doctor. Thank you.